Hi, Deborah Battistella here from Creative Concepts in Occupational Therapy. Welcome to the OT meeting room. Today's topic is home programs, and I'm moving forward a little differently than I have been in the past because metrics are showing me that listeners and viewers stay on for about 7 minutes. So I'm going to break topics up and create bite-sized pieces for you. Okay, so let's talk about home programs. We hear a lot about home exercise programs in the physical and rehab medicine world. And my question for you is, when do you establish a home program? Is this something that you think about as soon as your client is evaluated and placed on your caseload, as soon as you establish their occupational therapy treatment plan? Or is this something that you kind of throw together before the person is discharged, just so you can check off a box on that discharge paperwork? I worked in rehab for a long time, and I have done it both ways. And so the reason I'm thinking about this is because I do have a podcast. And if you are a neuro occupational therapist or you know a neuro occupational therapist, I invite you to check out the Noggins and Neurons podcast. I've started this with my co-host, Peter G. Levine, who is the author of the book, Stronger After Stroke, Your Roadmap to Recovery. And by the way, that is an amazing book. I often recommend that to stroke survivors and family members. So one of the things that we talk about a lot in our preparation for that is home programs and how they need to be established right away. So I've decided that this is an important topic for us as OTs to talk about. So moving forward, I think it's important to start a home exercise program or a home program as soon as you evaluate someone. And so we have to think about the rationale for creating and recommending a home program. We all know that people get better when they do their therapy. So if you're an inpatient rehab therapist or you work in a subacute rehab setting, you see people 5 to 6 days a week, maybe 7 days a week. And you know that it's that consistent interaction with them over time that helps them to get better. And when people leave those settings, we often recommend home care or we recommend outpatient. And the moral of the story is if you're an outpatient patient, an outpatient patient, you have to do exercises at home. I've had outpatient physical and occupational therapy, and everyone has always told me, you need to do this at home. And the other side of that is people can tell, your therapist can tell if a person is doing their home exercise program. So you as a therapist, if you work in those settings, you know if people are doing more than just what they do when they're with you during their skilled treatment time with you. So the purpose of home programs is to promote continued healing, promote continued improvement. And another thing that we don't always think about, I want to start a conversation with about today, is establishing new habits and routines. Oftentimes, we're asking people to do things a little bit differently or brand new from what they've done in the past. And so what better time and what better way to use our skill as OT practitioners than to create the program and help the client establish it as soon as we start working with them. One of the things that we learn in OT and OTA school are teaching and learning approaches. And what I want to ask you to contemplate is think about when you were in school and you felt good and you were healthy and you were learning a lot of new material. And think about the amount of effort and time that you put into learning that. So now take that information and let's apply that to the person who has had an interruption in their health. They're not feeling their best. People are worried. Now, sometimes people aren't thinking their best. And so it makes sense to use our teaching and learning approaches, our tell, show, do, the ropes approach, which is review, overview, practice, experience, and summary. All of those concepts, if we start using those and implementing a home program when the person is with us, think about how much farther along their recovery trajectory they will be and how much farther along their towards their home program being able to do it when they're discharged they will be if we get started right away. So we're going to apply our teaching and learning, understanding and knowledge, and we have to take a look at the client's current situation. So we need to understand important concepts about where they're at in order to come up with the right program. And we're going to use our OT skill to establish the home program as part of their treatment plan. So I love including this slide in all of these videos that I make. When you know better, do better. I'm going to take this a little side twist here. Maybe we need to do different, not just better. Maybe some of us do need to do better, but maybe some of us just need to do differently. So, drawing on some of the information I said a moment ago, some things that we need to do to get started. I just want you to think about where to start with developing a home program for your client. In order to know the type of home program they need, we need to do some clinical reasoning. We need to understand their diagnosis. Why are they on a skilled OT program? Are there any precautions that they have to adhere to? Are there any contraindications to certain types of movement or exercises? So, those are all things to take into consideration when we are creating a home program. We need to know their discharge plan. Where will they be going? Will they be going home alone? Will they be going home with someone? Are there supports in place if necessary? And we need to understand our client's current abilities. So if our client is cognitively attacked and they're going to be going home alone, then the type of program that we create, we will be teaching to them. But if our client has some cognitive impairments and they're going to need some guidance and direction with the home program, then we need to think about calling in the caregiver and training the caregiver. So those are your things to think about today, the points that I wanted to bring up today, and starting to think about home programs. So when are you creating them? Are you creating them? How can we incorporate our skills and knowledge as an occupational therapy practitioner into making home programs and starting off using our clinical reasoning skills by understanding the client's current situation, the discharge plan, any supports in place, and their abilities. So that's where we're going to end today. Up next, we're going to talk about home programs versus home exercise programs and establishing those for your client's success. Thank you for watching.